I've gathered my equipment. I have washed my hands. I've donned appropriate PPE, and then I've also ensured privacy for my patient. My patient today is Melina Sove. I will be doing a neuro assessment on her. Hi, Melina. My name is Olivia Sove. I'm a nurse practitioner student. I will be doing a neuro assessment on you today. Do I have your consent?
Yes.
So I'm assessing Melina's mental status. At this moment, I'm looking for behavior, appearance, cognition. I'm also assessing for thought process, and this will continue throughout my assessment. I'm looking for level of consciousness, orientation, attention span, as well as grooming and hygiene. I will assess the cranial nerves first. So cranial nerve 1 is olfactory. For the purpose of this OSCE, I will not be assessing smell with a familiar scent, but I will be assessing her nair patency. So Melina, can you occlude? Perfect. Close your nose. Take a nice deep breath. Okay, do the same with the other side. Perfect. Her nairs are patent. I will assess now cranial nerve 2, optic nerve. So for the purpose of this exam, I would have a Snellen chart 20 feet away, which I do not have. And then I would assess each eye individually for distal vision, and then I would assess both eyes at the same time. I would also use a pocket Snellen chart approximately 3 feet away. Again, this time I'm assessing for near vision, assessing each eye individually and then both eyes together. I will now do a wiggle test with Melina. I'm checking her field of vision. And so we are actually at the same height. So Melina, cover your right eye. I am covering my left. And you let me know when you see my fingers come into your periphery. Look at me straight ahead and let me know when you see my fingers coming into your periphery.
No. No.
Okay.
No. No. No.
Okay, and I was bringing my fingers in at about a 50-degree angle here, and assuming that my eyes are normal, Melina and I were seeing the finger wiggle at the same time. I will not be inspecting the ocular fundus for this assessment. That will be on the head, ears, eyes, nose, and throat assessment. I am now assessing oculomotor, still staying with the optic nerve 2, assessing oculomotor 3. So looking at both sensory and motor together. I am inspecting the shape and size and shape of Melina's pupils. I'm comparing them side by side to each other. They're both symmetrical. I'm going to inspect her pupillary reaction to light, looking for direct light constriction and consensual light constriction. So look at me straight, Melina. I'll be shining a light into your eye. My room is dark, so there's no light overhead. Okay, that was direct. I saw constriction. I'm now going to assess her right eye, indirect, and there's constriction there as well. So next I will be looking at convergence. So I'm going to look at the pen light, and what I'm going to look, follow the light. And what I'm looking for here is convergence. The eyes converge and they constricted. Watch the pen light again, Melina. So I want you to look at this pen light, and I want you to look behind my shoulder. So look behind my shoulder. Look at the pen light. Look behind my shoulder again. Look at the pen light. And so what I'm looking for here is dilation when she's looking distant, which I saw, and constriction when she's looking at the light. Next, I'll be testing her oculomotor 3, trochlear 4, as well as the abducent 6. I'll be using the 6 cardinal directions of gaze test. So again, using my pen, Melina, I want you to follow it, and I'm going to do the letter H sign. So across, up, down, up, cross. And what I'm looking for here is diplopia, nystagmus, as well as any ptosis, and I don't see that. I'm going to now assess the trigeminal nerve 5. I am going to do a sharp dull assessment, touches to her face. So Melina, I want you to feel this. This is sharp. This is dull. Okay, close your eyes, honey. Tell me what you feel.
Sharp, sharp, dull, dull, sharp, sharp.
Very good. I'm now going to also assess her mastication muscle. So I'll be palpating her temporal muscle as well as her masseters. So I want you to, Melina, clench your teeth, nice and sharp. Very good, strong. I want you to unclench, unclench, relax, relax, relax. Now clench. Very good. Move your jaw side to side. Perfect. So great. Masseters are strong. For this assessment, I won't be assessing her corneal reflex. Next is to assess her facial cranial nerve 7. Just want to say the anterior 2/3 of the tongue are associated with taste, and so that will not be assessed in this OSCE. But I will be inspecting again her facial symmetry, and I'll also assess the motor function of her face. So, Melina, can you please, I want you to lift your eyebrows nice and high. Okay, I want you to frown. Very good. Puff out your cheeks, and I want you to smile. Perfect. Shut your eyes nice and tight, close, tight, tight, tight. Okay, and I could not open them. And so, perfect. I'm also looking at any tear secretions, and her eyes appear well lubricated. So, perfect. I'm now going to assess, oh, so sorry, her vestibular cochlear cranial nerve 8. So, I want you to close your ear, and I'm going to do the whisper test.
1C8.
Very good. You heard that. And I would do the same assessment on the other ear. I'm now going to assess cranial nerve 9, 10, and 12. So the glossopharyngeal, the vagus nerve, and the hypoglossal nerve. And so for this assessment, I'm going to ask Melina to repeat 3 words to inspect your voice. Can you please say light, tight, dynamite?
Light, tight, dynamite.
Perfect. And I was listening for clear and distinct L, T, D, N sounds. I also want to note that the posterior 1/3 of the tongue is for the gag reflex, which I will not be assessing during this OSCE. I am, though, however, going to ask Melina to open her mouth and say ah, ah. And what I'm looking for is rise of her soft palate, and making sure that her oh, I'm having a brain fart. Her uvula is midline. Perfect, which I saw. Okay, can you please stick out your tongue? Nice and straight. It's straight and symmetrical. Oral mucosa is nice and wet and pink. Can you push your tongue into your cheek? Very good. Push your tongue. Very good. Any issues with swallowing? No issues with swallowing. Wonderful. Perfect. So everything is normal there. I'm now going to assess her spinal accessory muscles. So Melina, what I'm going to ask you to do is I want you to push your shoulders up, shrug, shrug. Okay, relax. Very good. And I'm going to hold my hand against your face. I want you to push against my hand with your face. Perfect. And do the other side. Perfect. And so her trapezius and sternocleidomastoid muscles are normal. I'm now going to sense her motor system. I'm inspecting for any involuntary movements or tremors or tricks, or just our hands out. I do not see anything. I'm now going to inspect for muscle and contour, noting any atrophy or asymmetry, and I don't see anything. Her muscle tone looks really great. I'm going to now assess for our passive range of motion. I will start with her hands and wrists. Hold on. Hands, wrist, going to her elbow, going to her shoulder. And what I'm looking for here is resistance or hog wheeling. I'm going to do the same with her foot. And I don't see any. resistance or cog feeling. And I would do the same on the other side. I'm now going to assess her muscle strength. I'm going to check for range of motion against resistance. Going to start with her elbows. And so I'm just going to do both sides for the sake of this. Okay, so push it up against my arms. So great strength. Push down. Wonderful. So no movement would be 0. 5 would be normal. I'm going to do the same with your wrists. So push up against my hands. Very good. Press down. Very good. I'm going to ask you to grip both my fingers nice and strong. Okay. Go like this with your hands. I want you to spread your fingers. Perfect. Nice and strong. A 5 normal. Do this. Okay. And opposition of thumbs is perfect. Next, I'm going to come for lower extremities. So again, Melina, I'm going to ask you to push your thighs up against my hands. Very good. Press down. Okay. Push up. You see that? Press down. Very good. Okay. Push up against my hand. Very good. Press down. And of course, I would check the other foot. Exactly the same. And her strength movements are 5, quite normal. Now I'm going to assess coordination. So I'm going to ask you to do, so this is rapid movement testing. You're going to touch your nose and then touch my finger. I will be moving my finger. Touch, 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 touch. Very good. I'm also going to ask you to run your left heel down your right leg. So right heel down your right leg. Perfect. And she would do that with the other side as well. Okay, so now I'm going to assess her gait. Melina, can you stand, please? I'm going to ask Melina to walk. Please stop right there. So I'm going to ask her to walk normally towards the wall. Walk normal. And I'm assessing her gait. Okay, I want you to do 1 foot in front of the other. Tight rope walk. Very good. Normal. Okay, I want you to now go on your tiptoes, walk towards the wall. Very good. Stop. And now can you do a heel walk? So just on your heels. Very good. Okay, remain standing for me. So I'm going to ask you to put your leg up and do like a little dip. Very good. And we would do the same with the other leg. So stand nice and tall, straight. Close your eyes. And so I'm just going to, again, assess her coordination while she's standing. She's not drifting or anything. I would do that for 10 seconds. Melina, put your hands out and up. And again, I'm going to support her. And what I'm watching here is for pronator drift, which would be this, which I don't see. So there, sorry, Melina, that's okay. It's normal. Perfect. So you can sit down. I'm now going to assess Melina's sensory system. So I'm looking for superficial sensation. I'm going to start with, let's start with soft. So Melina, of course, I'm going to just do one side right now. We would, of course, do both sides. So tell me if you feel this.
Yes. Yes.
Checking the thumb and digit 5.
Yes.
12
Yes. Yes.
and
Yes. Yes.
very good. And now I'm going to do sharp, dull sensation test. So tell me what you're feeling. Close your eyes.
Sharp. Sharp. Dull. Sharp. 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 Dull. Sharp. Sharp. Dull. Dull. Dull.
Oh, sorry.
Sharp. Sharp.
Okay. Perfect. And of course, we would check the her lesson of this as well. Of course, I'm not checking temperature because everything came back normal. I'm now going to assess for vibration. I'm going to use my tuning fork over the finger or toe joint. So I'll start with finger and have your hand. And of course, I would check the other side. So I'm just going to.
Done.
Okay. And then check shoulder.
Done. Done.
Okay, so her vibration, sense of vibration. Were your eyes closed or were they open?
Open.
Oh, shoot, her eyes should have been closed. So next time we do that, please know that her eyes should have been closed. I'm now going to assess for proprioception. So I'm going to, grab her finger, her hands, close your eyes, and tell me if your finger is up or down.
Down.
Very good. And again, I would assess the other side as well. I'm now going to close your eyes, going to assess for stereognosis, and I'm going to ask her to identify a common object in her palm. Your hand. What do you have in your hand?
A key.
Very good. And now I'm going to assess for graph aesthesia. Close your eyes again, Melina. So I'm going to draw an object in the palm of your hand. You tell me what I'm drawing.
E.
Very good. I'm now going to check her deep tendon reflexes, starting with her bicep muscles. So relax here. Very good. So cross here. I'm going to support her elbow. And very good. And again, I'm grading this from 0, meaning no response, to 4+ brisk response, and her response is normal +2. So I will assess the brachioradialis here, looking for cranial nerve C5 and 6. Very good. I'm going to assess her patellar. So just relax. That was really brisk. Hold on. Serious? Oh my gosh, Melina. All right. And I'm now going to assess. You see this? I'm going to try to get in here. So I'm going to assess for Achilles. I have the flex up. Okay, perfect. Very good. So her deep tendon reflexes were all a 2+. I'm now going to assess for cutaneous stimulation. We won't be doing the abdominal assessment for this OSCE, but I will be checking the bottom of her foot. So I'm looking for plantar. So I'm going to start. Okay. Very good. And so I saw what I expected. She did pronate, which is normal. And last but not least, I'm going to assess the, meningeal. Assess special test for meningeal signs. I'm going to let Melina flat. I'm going to put my feet up. See this? Okay. So, and I'm going to flex her head forward. I don't see any bending of the knee or ankle. So this is the Rudinsky sign. Sorry. And so I didn't see any flexion of her knees or hips at all. And so the next one I'm going to assess for is the Koenig sign. Sorry, the bed doesn't go up. Koenig sign. And so what I'm looking for here is going to flex her knee up the hip. Any pain? No. Okay. And I would do the other leg as well. Again, looking for any meningeal irritation, looking for pain or any increased resistance, which I did not see. Okay, that's it. Thank you so much. That's my neuro assessment.